Welcome to the press briefing. On stage, we have Dr. Zhang Zhokwan, Head of Communicable Disease Branch, CHP from Department of Health, Dr. Lau Ka-hin, Chief Manager, Quality and Standards Hospital Authority, Ms. Rowena Wong, Chief Manager, Chief Chinese Medicine from Hospital Authority, and Professor Lin Zhixiu, Associate Director, School of Chinese Medicine, the Chinese University of Hong Kong. Dr. Zhang, we had 73 additional confirmed cases, and the number are 100872 to 1059, and the aged is between 1 month to 89 years old. We have got 37 male and 36 females, 12 within cases identified within the restricted area, and also 1 close contact. So there are 13 from the restricted area. Among the 73 cases, 4 are imported from Belarus, Pakistan, Dubai, and the Philippines. 69 cases are local. Among local cases, over half are with sources unknown, and there are 38 and 31 remaining linked cases. For the 38 cases with unknown sources, include 9 of the 13 cases I just mentioned. They were identified in the restricted area of Jordan. Among the 69 local cases, in the Yao Chimong area, we have got 14. And the 14 include the 13 from the restricted areas, 8 from Sam Shui Po, including 6 from the specified area in Sam Shui Po, with 1 building subject to mandatory testing. Among the cases, there's 1 from Kinning elderly home with no symptom. The building he lives in is now subject to mandatory testing, so the whole elderly home has already been tested once, and Kinning elderly home is on number 73 of Ferry Street in Jordan. It is a rather small elderly home. There are about 20 residents and 5 to 6 staff members. They have to be quarantined. Among these cases, there is 1 Chinese medical practitioner with confirmed cases within the family, and his name is Mr. Zhong Gamchun, working in Shao K1 Tianyut Plaza. And a doctor from the Department of Health has consulted this Chinese medicine practitioner, and is a preliminary positive case. The onset date was the 23rd, and during the incubation period, we have to trace patients, and some of them have to be quarantined because a member from the Center for Health Protection has consulted the CMP, so we may have to extend our contact tracing. For patients who did not consult the CMP during the incubation period, I hope they can be mindful of their own health, and they should seek medical health if they feel unwell, and if there is any worry, they're encouraged to be tested. There are 3 new buildings subject to mandatory testing. One has got 2 units. In North Point, Tongfat Building, Block C, there are 2 units involving 3 cases. They are on the same floor. They are neighbors, but so far we cannot see any link between them. And there are 2 more buildings with 1 case each within the Sam Shui Po specified area. One is 280 to 286A of Yuchao Street. There's one case, and also number 173 of Yuchao Street with one case. That's all from me. Thank you. And I'll give the floor to Dr. Lau to give us an update of the situation with HA. As at 9 a.m. today, in the past 24 hours, the HA system has noted 94 reportable cases. In the past 24 hours, another 2 patients in public hospital passed away. One is 8449, released yesterday, and another is 9730. We issued a press release earlier on to announce the news. So far, 166 patients have passed away in public hospitals. In the past 24 hours, another 22 confirmed patients were discharged. So far, 9,056 confirmed cases have been discharged. As at 9 a.m., 822 patients are being treated in 24 hospitals and AWE community treatment facility. 35 are in critical condition, 34 in serious condition. The remaining 759 are in stable condition. As at 9 a.m. today, the hospital had activated 1,224 negative pressure beds, occupancy rate 69%, and we had 676 negative pressure wards, utilization rate 77%. Now I have a case involving the Queen Elizabeth Hospital. Yesterday, 3 nurses from the hospital were preliminarily confirmed yesterday. The first nurse has been working in the general medical ward. The other nurse has long been working in an isolation ward. The third nurse has, in between the 12th of December to the 17th of January, worked in an isolation ward for 6 weeks. And starting from the 18th of January, she was posted to a general medicine ward again. We attach a lot of significance to these 3 cases together with CHP. We are now doing contact tracing and investigation. For the first nurse, who has always been working in a medical ward, who has never served in an isolation ward, has got confirmed cases in the building where she is living. The nurse was never in contact with confirmed cases at work, so I believe it is more likely to be a community infection. On the 24th of January, the colleague worked for 1 hour, and then she sought some consultation at the A&E department. She provided a deep throat saliva sample yesterday and was preliminarily confirmed. She had meals with 2 more colleagues, and they are being listed as close contacts. The colleague was in appropriate PPE when working in the medical ward, so no patient has been classified as a close contact. The other nurse, who has been working in an isolation ward all along, on the 23rd in the morning, she was on night shift on the 22nd, and so she went off duty in the morning of the 23rd, and she felt unwell afterwards, and she developed a fever. So on the 24th, she sought medical help and also performed a deep throat saliva sample test, and she was confirmed yesterday. The nurse has taken care of confirmed cases since she has been working in an isolation ward. However, when taking care of patients, she was in full appropriate PPE.
所以就被列為
4 hospital staff had meals with her, so they were regarded as close contacts. And she also had meal with a staff in the HA headquarters, so that person was also specified as a close contact. Another nurse is a nurse in the general medical ward. But from the 7th of December to the 17th of January, she worked in isolation ward. So on the 18th of January, she was transferred back to the general medical ward. And on the 22nd of January in the morning, she completed her shift, and she felt a little bit unwell. She had some cough and phlegm. And then on the 24th, she went to an A&E department. After checking and examination, she was preliminarily tested positive for COVID-19. When she worked in the isolation ward, that is from the 7th of December to the 17th of January, she took care of some confirmed cases. She wore suitable PPE. After the contact tracing, we found out that 3 colleagues had meals with her, so they are now regarded as close contacts. While working in the GM ward, she wore the PPE, so no patient under her care is now is regarded as close contact. And then, apart from these 3 cases, there were 9 close contacts for whom quarantine will be arranged. Two of the general medical wards have now been closed for new cases, and then we would deploy manpower appropriately to handle the situation. And if necessary, the HA would also ask other hospitals to help out to cope with the workload. And the general public are advised not to go to the Queen Elizabeth Hospital A&E department for consultation as far as possible. They should go to other hospitals and clinics as appropriate. This would reduce the burden or imposed on the QEH. We have arranged staff to do the cleansing of the relevant facilities. And to be prudent, the QEH management has arranged for comprehensive testing for all staff. This is being arranged by a contractor. We believe that this will begin tomorrow. Ms. Rowena Wong. Well, the HA has been looking into the involvement of traditional Chinese medicine in handling the epidemic. We have this special Chinese medicine program for COVID-19 inpatients, for discharge, for general consultation, patients receiving treatment at this community treatment facility, and also for those who have been discharged. Some 700 patients have been have received the service, and starting from today, January the 25th, the HA will provide COVID-19 patients staying in the community treatment facility at Asia World Expo and an additional option of CM service. This is the special Chinese medicine program for COVID-19 patients for those who are over the age of 18. The enrollment is on a voluntary basis. We just want to give the eligible patients an additional option, and also to relieve their symptoms. Patients participating in this program will be clinically assessed by Western medicine doctor and Chinese medicine practitioner for suitability. In planning for this new service, we have an expert panel to develop the clinical protocol involving experts in clinical areas and Chinese medicine from other facilities. We have involved experts in clinical areas and Chinese medicine from 3 local universities, together with medicine, infectious diseases, and toxicology experts of the Western medicine side from HA. We would prescribe the suitable Chinese medicines to participating patients, and there will be a follow-up consultation and treatment based on clinical needs afterwards. We hope for the patients they will be given extra options, and the CMPs will be able to participate in this this program to handle COVID-19. Please, this is now open for questions. Please identify your organization first. I want to ask a question about Laguna City Block 5. It said that the number of people tested is below what was expected. Can you confirm the number of people who have been tested? Would there be another testing order to ask those who haven't done so to do so? And also, do you have any new cases in the HA facilities?
最明顯、至有效嗰
No, Block E, how many new cases are there for Block E in Laguna City, and what's the efficacy of Chinese medicine in the treatment of COVID-19? Can you share with us some clinical information? There were 3 units involved in the Laguna City Block E. Therefore, we have sent people to inspect the environment, and now the Flat E, people will be evacuated. Apart from Flat E residents, we would ask that other residents in the building to get a second test. As for figures, I don't have any new information. On the involvement of CMP's outpatient service, we have been offering service to 700 discharged patients. Many of them complained of shortness of breath, etc., or the loss of sleep. After consultation with CMPs, many of them have improved. As for the efficacy, I would defer to Professor Lin. But we haven't actually started CMP service for inpatients in Hong Kong. But in the mainland, it's a standard practice to involve CMP in treatment of the COVID-19 patients. It's an integral part of their treatment protocol. I've checked some literature, clinical literature. According to the literature in the mainland, the total efficacy rate is over 90%. Chinese medicine is mainly effective for certain issues. First, the quick relief of clinical symptoms such as fever, cough, and other clinical symptoms. Secondly, Chinese medicine can reduce mortality rate and increase the rate of recovery. It also can stop or slow the progression from general to serious. The mainland experience tells us that it is good for physical improvement. And they have a suit for lung problems. And because of the time constraint, I cannot really elaborate today.
That gentleman on the second row. I'm from TVB. Good afternoon. like to ask a follow-up question in relation to Jordan. Within the sealed area, 13 cases were identified yesterday. Do you know whether they have complied with the compulsory testing notice? Now, there are 407 households not yet found. Will you prosecute them for breaching the order? Now, today, one case is a 1-month-old child. Can you tell us the case number and also details of the infection? The 13 cases include a 2-year-old infant, a member of a 3-person family. If we exclude this, the remaining 12 cases have been tested. Only 2 were not tested. 1 lives in the core area. Another one lives in a building which has not been subject to mandatory testing. So in between 16th and the 21st of January, they were all tested negative. There are a few with symptoms, and they were tested on the 23rd and tested positive. The remaining cases do not have any symptoms. Next, speaker is off mic. Speaker is off mic. I am not aware of that. Case number because her family are positive as well. I think you have the case number in the handout. It's 10136. The case number is 10136. Speaker is off mic. Speaker is off mic. All her family members are confirmed, and she is also a confirmed case after hospitalization. Next, Oriental Daily. I'd like to ask about the situation at Laguna City. So it said that at 16E, there was a family gathering, and then one of the participants was just a guest, not living there. Can you tell us his case number and also the case numbers of 2 security guards confirmed? Because one of them lives in Reclamation Street. I'd like to know whether it's in the core area or the specified area. I'd like to know the date of onset for the first patient in Laguna City. And we're told that only half of the residents in the restricted area have been subject to mandatory testing. Will you require them to be tested again? And now 9 nurses have been confirmed, and they're now considered close contacts as a result, and A&E department is to be closed. Is it quite serious? Will it paralyze the operation of public hospitals? I will not mention the case numbers in particular. One household had the earliest onset, and the date of onset was the 9th of January. I will not mention the case numbers of the security guards. All residents of Flat E will be evacuated, and when they return, before they return, they will all be tested. The unit with more residents, 3 nurses when had contact with colleagues when they were within the hospital. They might have shared meals, and now 9 nurses have been listed as close contacts, and they have to be tested and be under quarantine. Now, if some of the nursing staff is under quarantine, then redeployment will be done, where we have more than 1,000 staff members in the hospital. So it is possible to redeploy manpower to fill the gap. Together with a ward that was closed, and now taking the two today, there are 3 wards that have to be closed for testing and disinfection. This would affect the admission of patients from A&E department. Our A&E department is still in operation. It will continue to provide treatment to patients. Now, there are 3 medical wards with medical staff infected, and patients are being tested, and the wards are being disinfected. So these 3 wards have suspended admitting new patients. As a result, patients for admission may have to wait at A&E department longer. Now, because there are more patients stuck in A&E departments, we hope that members of the public with mild symptoms can seek consultation at general outpatient clinics or private clinics. But for serious and emergent cases like a trauma, well, A&E department is still in operation. Speaker was off mic. We'll discuss with the Center for Health Protection as regards the duration of suspension for each and every ward. Now, for one case, we believe the chance of a community infection is higher, and so the ward may not have to be suspended for too long. The most important thing is to test all patients in the ward. We understand that within a week, if all patients are tested negative, then the ward can then reopen to new patients. The duration of closure will be different for different wards, but it would at most just be a few weeks. No, there is no contact among these nurses. No. Let me put it this way. As I said, one nurse worked in an isolation ward from the 7th of December to the 17th of January. During the period, on the 13th of June, there was interaction between this nurse and another nurse that was confirmed, but they are both in appropriate PPE. So we so far cannot find any epidemiological link among the 3 patients, the 3 nurses. Let's take an English question. Over here.
I'm from RTHK. Can I first ask DHA about the 3 nurses who are infected in Queen Elizabeth Hospital? Are there any chances that the 3 cases are connected, like if they have met each other before? And how will that affect the operation of the hospital after 9 nurses are put in quarantine? And I can also ask about the Chinese medicine service in Asia World Expo. Can you tell us what are the benefits of using Chinese medicine to treat COVID patients? Like, for example, will they recover quicker, or will the treatment period be shorter? And finally, can I ask Dr. Chuan about the resident in a Jordan elderly home? Can you tell us what are the likely source of the resident's infection? Could it be because of environmental contamination in the building? Thank you.
We have 3 nurses who have been found COVID preliminary positive yesterday. One of the nurses who are working in the isolation ward all along. Another nurse is who has been worked in the isolation ward from 7th of December last year to 17th of January this year. In 13th of January this year, these two nurses have been working in the same shift. So they have been a while working together and have some contact in the presence of the adequate PPE. Otherwise, up to this moment, we can't find any epidemiological linkage among these three nurses. For the operation, if you can remember, we have closed one ward before as a nurse has been confirmed. So up to this moment, there are 3 medical wards are closed for admission of cases. So it will affect the admission of cases from the accident and emergency department if the patients need to be admitted to the medical ward. Because of that, we make an appeal to the Hong Kong citizens that to try to avoid to go to the accident and emergency department of the Queen Elizabeth Hospital because of some minor symptoms. The citizen can go to the general outpatient clinic as well as the private doctor if they have mild symptoms. However, at this moment, the accident and emergency department are still in working. So it can still receive the patients from trauma or from any emergency situation. And the people who think if they need emergency treatment, they can still go to the accident and emergency department of Queen Elizabeth Hospital.
Regarding about the Chinese medicine, since last year in April, we started our outpatients rehabilitation program. From that, we actually collect a lot of clinical outcomes and information, and we conduct a study over the treatments. And so far, we have observed that a lot of patients, they actually complain about shortness of breath, weakness, cough, and for all this kind of symptoms, the Chinese medicine show effective treatments over that. So basically, based on these observations and also a lot of study that we obtained from the mainland, we believe that the Chinese medicine can help to release a couple of the symptoms that the patients have been suffering from the COVID-19. So when we started for the program, we are going to start it in the community treatment facility, while the patient, they have the mild symptoms, but they are not on the antivirus treatments, so that we actually safeguard about the treatment protocol and to provide the best and safety treatments for the patients.
The source of infection for the elderly in the residential care home is still being investigating. We have only one case so far, and she's bedbound. She's wheelchair bound, so she usually do not leave the residential care home except for follow-ups or admission to hospitals. So the sources may be from other staff or from the residents or even visitors, but we still need to investigate.
我哋答多條英文問題，嗰邊最後嗰行。
From South China Morning Post. Dr. Tron, there seems to be an increasing trend in untraceable cases, since today more than half of the cases today are unlinked cases. So could you explain or elaborate why that is? My second question is about the Yamate fruit market and whether there are how many cases are there near the Yamate fruit market, and whether authorities are worrying about a possible outbreak, or maybe there could be a lockdown in that area of the fruit market. And my third question is about the very recent news about Laguna City. And can I ask how many households or residents will be evacuated from Laguna City? And will they need to check other blocks in the building as it is a private residence? Thank you.
The proportion of unlinked cases in the every day is, especially today, is varying. I think there are still quite significant silent transmission in the community. Not all cases are being picked up by our surveillance system. So I urge the public, if they have any mild symptoms, even they have undergone testing previously and have a negative result, they should go for testing and see medical attention as soon as possible, so that we can we can control and prevent further spread. Otherwise, the numbers may have exponential increase. So depends on how to define the fruit market. What is the boundary of the residential buildings? So I do not have the numbers. For the Laguna City, we are still calculating, because all the E blocks except those with cases will be moved to the quarantine camp. So I will have the figures tomorrow.
下位嗰邊第三行最個行色外度其實。
幾位醫生你好，明報想。
I'm from Mingpao. Dr. Chuan. There were 13 cases discovered in Yamate. Can you tell us the numbers? How many households are involved? How many of them live in subdivided units? You said that there was one living in the core area who was not tested previously. Does it mean that he or she broke the law and will be prosecuted? And also, what's the work of the doctor, the HA doctor, who's tested preliminary positive? And what was the source of infection? And it said that there was no epidemiological link between the 3 nurses of QEH, but the onset dates were very close. Was there a cryptic chain of infection in the hospital? Would there be general testing for other staff? And whether any healthcare workers in the hospital have conducted risky procedures? The numbers concerned that is 10087 to 10098, and then another one 10125 for those cases in the restricted area. For the Department of Health personnel who's been tested positive, we will issue a press release in due course. As for those living in the core area, the information that I've got is from the testing centers. I have to check further to see whether that person did not comply with the testing order and was never tested. Well, the 3 nurses were confirmed to be infected about the same time. So we had contacted the healthcare workers and the patients who were in contact with them. They will all be tested. So to be doubly prudent, the hospital will, starting from tomorrow, appeal to all staff working in the QEH for a COVID-19 testing. And the purpose is, as suggested by the reporter, that we would try to find out whether there is any alternative possibility. From what we have learned, we don't see that is a communication. There's a communication chain among our staff, but all the staff in the hospital that would be tested as from tomorrow. As for the genetic mapping, we will do this and we'll ask our colleagues in the hospital or from the universities to do the genetic testing. As for the 2 colleagues who work in an isolation ward, we asked the one who had all along been working in isolation ward and the answer, whether any risky procedure have been conducted, and nothing that would. And she said she did nothing that would create aerosol or mis-related procedure. So far we haven't found any risky procedure carried out by them. And just as per the standard practice, they wore standard PPE.
The lady there, I'm from HKET. I'd like to know the number of preliminary positive cases, and then this will be the second time Laguna City is subject to mandatory testing. And then Professor Yuen, that perhaps in the first round somebody did not comply, and how can you ensure that people will comply this time? And is there any idea as to the source of infection for the resident in the elderly care home? Has there ever been visitors? Has he gone out? And regarding the Chinese medical practitioner, what is his case number? And I'd like to know the day of onset for the staff member of the Department of Health. Could it be possible that he passed the disease to the CMP? And for Chinese medicine services in AWE, what will be the daily capacity? And is it that after the patient has left AWE, he will no longer be treated? Why all of a sudden you've introduced Chinese medicine to AWE? Is it because of limited manpower or the lack of effectiveness with Western medicine treatment? And we understand that a nurse who has worked in an isolation ward was posted to the medical ward again. Would there be any transition period? Would there be any cooling off period or buffer period so that the two postings will not be back to back? Now, I have no idea. I don't have figures yet as to the number of residents that have been tested in the first round. Now, since there will be a second round of compulsory testing, we hope residents can cooperate so that we can identify cases and stop the transmission chain. Of course, the government will not roll any possible enforcement action. The elderly home case is 10100 because there is only one case in the elderly home, so we cannot confirm what is the source of infection. And the elderly resident rarely went out, with the exception of going to hospitals. So her getting the case infection within the home is more likely. The case number of CMP is 10157. The dates of onset of CMP and the doctor are quite close, and the CMP has got a family member with an earlier onset date, so we still have to investigate. Colleagues working in isolation wards have very close set of infection control measures, including PPE they have to wear and training they receive, and on a regular basis they have to be refreshed on their training. So if a colleague dons proper PPE, the risk of infection is very, very low. So starting from the attack of COVID-19, we have never asked colleagues that have served in isolation wards to suspend service for a while before returning to the ward, because we believe our infection control measures are effective in protecting our colleagues. Right now, we really don't know how our colleagues got infected. It could be in the community or from our workplace. Therefore, in each and every case, we're very prudent. We ask colleagues and experts to check to see whether there is any systemic reasons. When need be, we will improve our measures. But it's been more than a year. In terms of PPE and for our colleagues working in isolation wards, according to our experts, we are still safe. As for Chinese medicine service, Well, in 2018, Chinese medicine has already been incorporated into our healthcare system, and they're important partners in the fight against the disease. Starting from April last year, our general outpatient clinics have already launched special treatment for patients that have been discharged. And so we have got statistics and experience in treating COVID-19 patients. And we've also got the collaboration between Western and Chinese medicine, and both the Western and Chinese medicine teams of the view that now this is the time to launch a special Chinese medicine program for COVID-19 inpatients. There is no particular target for number of patients treated a day. We will provide treatment to suitable patients, and then we will arrange a 3-day course, and then after a patient is discharged, he can then receive further treatment at our clinics under the outpatient program. As regards what patients are suitable for Chinese medicine, I'll defer to Professor Lin. We're going to provide inpatient service at AWE Community Treatment Facility, and most of the patients there are of mild symptoms, and some of are taking Western medicine. So we have a protocol. If a patient is already taking antiviral, he will not be covered by our inpatient program. We'll also have to consider the general physical conditions of the patient. If his liver and kidney functions are rather abnormal, then he will not be eligible too. If the patient has known allergy towards Chinese medicine, and some may have a G6PD condition, some Chinese medicine may cause side effects on patients with GDP6. And again, they will be screened out of the inpatient program. The lady there, I'm from Hong Kong 01. I'd like to know the following. For the CMP who's confirmed, we understand that he has a family member who was also confirmed. What was the onset date and what was the case number? When was the last time the CMP reported duty? Has he consulted? Has he seen patients? And if he has taken off his mask during treatment or consultation, then will patients be regarded as close contacts? And as for inpatient program at AW, I'd like to know the types of medicine or prescription that will be given to patients. Can you tell us the flow, please? I will not disclose the case number of the family member of the CMP. Anyway, the onset date was the 22nd of January and also covered in today's patient list. Now, because the CMP is a confirmed case, so patients he has treated will be considered as close contacts and be sent to quarantine center. For the rest, we will suggest testing for them, because we have a staff member who consulted the CMP, so we have to check the dates first. Professor Lin?
As regards how CMP treat COVID-19 patients, the expert panel has had a few rounds of discussion, and we have a preliminary program for this. We are going to divide the patients in 3 categories under the TCM principles. Our prescriptions will be traditional TCM prescriptions. We would divide the patients into 3 categories. One would exhibit symptoms related to stomach related to or fear of wind and wind related fever, and we would use a yin qiao. And the other is suffering from wind related coldness, and we have a prescription to enhance liver functions. This is a prescription used extensively with proven efficacy in the mainland. So we have this detox prescription for lungs. And the first one is for those with negative yin qi. And we have a Qing dynasty prescription for this third category, and with some modifications depending on individual symptoms. Our Western doctor colleagues would do the daily consultation and checking, and they would refer appropriate cases to our CMP colleagues, and then we will explain what will be offered, and consent will be sought. Every time we would offer a prescription for a 3-day course. They are granulated pills, so that they would take the prescription on their own in the community treatment center. I would like to know more about the address of the Chinese medical practitioner Zhong Kam Chun. Is it the Smiling Plaza in Shaoqiwan? And as for the Laguna City case, what's the name of the visitor? And what is the case number? As for the nurse who once worked in the isolation ward and was subsequently transferred out, how many patients did she contact? Well, the information I have is that he worked at Smiling Plaza, Shaoqiwan. As for individual cases, so for individuals in the Laguna City case, I am not in a position to disclose more. I have no information on the number of patients that the nurse contacted. I'm from Apple Daily. I have a question about the nurses at QEH. The 3 of them, who have been tested positively now. One of them was transferred out of an isolation ward. There was an outbreak last year in an isolation ward in the same hospital. Is this new case related to Ward A6 as well? And now you have to suspend the admission of new patients for 3 medicine wards. How many? What are they? Are we A5, A6, A10, or similar numbered wards? Are there 3 of them? Well, I'm not quite familiar with what happened last year. Let's talk about the latest cases. We are talking about 3 nurses. One work in A10, an isolation ward. One served in the isolation. One of them served in the isolation ward for 6 weeks, and then was transferred back to a general ward, the E6, Ward E6. And then there was another case where we would think that she got infected in the community because there were other cases in the building she lived. And then she did not come into contact with any patient during the work in the queue, although she also worked in A6. Notwithstanding that we are still conducting an investigation, there were 9 close contacts. I received the latest information that the number has increased to 10. So things are changing all the time. It was something that we became aware of yesterday. There were 3 wards and 3 colleagues involved in, and we have been doing the contact tracing and also the source identification or since then. A10 is an isolation ward. There's no need to suspend the operation because it has been admitting COVID-19 patients. We are now suspending the admission of new patients to E6 and A5. But the suspension for A5 will come to an end very soon. And such being the case, the service provided by the A&E Department of QEH will be affected. That's why we advise people to stay away as far as possible from visiting A&E Department. And these cases are in the vicinity of with the restricted area in Yau Ma Tei and Jordan, because our colleagues do pass by the relevant areas when they go off from work, and we would arrange for COVID-19 testing for the colleagues in the hospital. And from AM 730. Do you have the detailed address of the Chinese medical practitioner, Mr. Chung, Dr. Chung? And what about why do you have to evacuate all the 20 residents of a Kin Ning elderly home? Does Dr. Chung, the CMP, run a clinic at Parker Street in Yau Ma Tei? And for the cases involving the nurses, have you gathered environmental samples for testing? And after making the appeal for the public to use other A&E service, have you experienced a drop in the number of patients? As for the CMP service in the community treatment center, would it be extended to other facilities and clinics? Well, we know that the Chinese medicine practitioner work at Smiling Plaza, but we will check whether he also runs other clinics. As for the elderly home case, well, it's not a big one, and some of the residents have no mobility problems, so they were all consider close contacts.
除咗
As far as I know, the 3 nurses now, 2 of them work together at an isolation ward in the same shift on the 13th of January. So far, of course, could there be any contact in the changing room? That's possible because they share common changing rooms. And however, we have male and female changing rooms. All our pantries and changing rooms and pantry. Now, all places where these colleagues have been to, including canteen, will be thoroughly cleansed and disinfected. And we'll also take environmental samples. We have taken environmental samples, but results are pending. The Chinese medicine service at AWE will be from 9 a.m. to 6 p.m. We have a hotline for inquiries by Western medicine doctors and also patients, and the operating hours from 9 a.m. to 9 p.m. The Chinese medicine clinics will send their Chinese medical practitioners, and every time there will be 2 resident CMPs to provide services. 7 Chinese medicine clinics have already deployed staff to take part in the program. Will be extended to Hong Kong ICC. Well, we'll first activate this inpatient program. We have to take stock of the experience gathered, and we will also work very closely with the 2 teams before we decide on the way forward. It's about time we end today's press briefing. Speakers off mic. The Chinese medicine clinic cum training and research centers. I can give you information later. Chong Kam Chun 0101 Smiling Plaza.
Cam
Chun 中金泉. The Chinese character gam means gold, and the Chinese character chun means perfect or complete. 中金泉.